Well, as you know, WCTC is pleased to be the official media partner of the American Heart Association of New Jersey. Of course, the Go Red for Women movement that we stand firmly behind, and the upcoming Go Red for Women luncheon that's going to be happening in May that we'll be a big part of, so we're honored for that once again. Heart disease, as you know, continues to be the leading cause of death for both men and women in the United States. And according to experts, it's only going to get worse. By the year 2035, 45% of Americans will have at least one issue that is related to heart disease, but fortunately there is some hope on the horizon. My guest this morning on the Jersey Central Newsmaker Hotline is the professor of medicine at the David Geffen School of Medicine at UCLA, and it's great to speak to Dr. Matthew Budoff this morning on WCTC. Good morning, Dr. You're up early for us today. Thanks so much for doing so.
Oh, pleasure. Thanks for having me.
West Coast to East Coast. I like it. Well, what have we learned about the risks of cardiovascular disease in the past year, Dr. Budoff? Has there been some eye-opening information that we've learned?
Yeah, so I think, people need to recognize, unfortunately, that heart disease is still the number one killer. So more people are dying of heart attacks and strokes than all cancers combined. So it's really something we need to focus on. And as you mentioned, women are also just as vulnerable. But there's been some great breakthroughs with some really nice new therapies to reduce our risk further.
I mean, it used to be you talk about, just take these fish oil supplements or, take an omega-3. This is good for heart health. Are those things like that? Are they good for you, doctor? Are they bad for you? Are they part of a plan to maybe generate some good heart health for people?
Yeah, so we've really had a mixed message over the past year, and I think it's becoming very clear now. But the dietary supplements have not worked very well, especially when we add them into other treatments like the cholesterol pills, the statins, to lower our bad cholesterol. They're probably just not very pure. It's a mixture of things. But there has been a new therapy that we've seen, Vascepa. It's a prescription-only omega fatty acid. It's EPA. And it really did demonstrate a very nice benefit in a large clinical trial.
Wow. What about statins, doctor? Have they proven to be effective in your years of studying this?
Yeah, I think statins are still our cornerstone of treatment. We know they reduce your risk of heart attack, stroke, and cardiovascular death. So the first thing that people should do is talk to your doctor about what's right for them. But if their bad cholesterol is high, the LDL, then that's going to be important to get on a statin treatment.
Okay, because I can remember being a kid, my dad was on statins for years and years, and he eventually died, but from something else. He died of a very rare lung disorder, but apparently whatever he was taking for his heart proved to be beneficial for him, so of course I was grateful for that. But doesn't the heart of everything, no pun intended, Dr. Budoff, start with diet and exercise for everybody? Isn't that sort of like the cornerstone of good health for everyone?
Absolutely, and it's really important. I always try to advocate for at least 20 minutes 3 times a week. So in a 168-hour week, I just need 1 hour for people to really try to get their heart rate up a little bit and exercise. Diet, of course, we need to moderate what we eat, but it's really helpful to look beyond those when people have higher risk.
Is there a hereditary factor in this too, Dr. Budoff? Is heart disease a generational thing?
Yeah, so, family history is really important. If your parents, if your brothers and sisters have heart disease, then you're at increased risk as well, and you need to really talk to your doctor about what you can do to reduce your personal risk.
When it comes to diet, my doctor always gives me the advice of try to have as colorful a plate as possible. Have some vegetables, mix it up a little bit. Proteins, of course, in the right serving sizes are good as well. But what we choose to eat, doctor, continues to be a big factor in our overall health.
Absolutely. I can't agree with you more. I think that getting those fruits and vegetables, we still advocate to try to get 3 to 5 servings a day, really helps to supplement our overall diet. Probably cutting down on some of the carbohydrates and pastas and rice in favor of protein and vegetables is a good way to go.
Exactly what I've done in recent years. I eat very little in the way of white starches, potatoes, rices, breads, and I've really stepped up vegetables and fruits. My wife almost hit the floor. I actually had steak with a side of cauliflower the other day. I thought she was going to pass out, thinking I would never eat something so healthy. But for me, I can tell you personally, it's made a big difference for me. If people could dump one food right now, is it soda? Is it high fats? What's the one thing that we could cut out right now and make ourselves feel a little bit better?
Yeah, so, obviously soda has a lot of empty calories. That's a good one to get rid of. I would say the white foods are the bad ones, if you can just cut down on them. So white bread, pasta, potatoes, and white rice are really the four key things that if you get rid of those white foods, as you said, get a more colorful plate, you'll do a lot better.
And that's advice that I've been following for the last several years, and my doctor's very happy of my progress. He says I still have work to do, doctor, but I'm definitely getting there. And you're on the West Coast today. I'm on the East Coast. This is not an East Coast, West Coast thing. This is an American issue for all parts of the country in relation to heart disease, right?
Yeah, no, it affects men and women equally. It affects West Coasters and East Coasters. I'm a transplanted New Yorker myself, but I think it's really important to think about heart health. Unfortunately, as we get older, it's what's going to cause us problems, and it's avoidable with some good lifestyle changes and maybe some prescription therapies.
Yeah, and you probably know a lot about our city, Dr. New Brunswick, New Jersey, which is called the healthcare city here in New Jersey because I'm surrounded by great hospitals, and I always get to talk to great health professionals, much like yourself today. And they always tell me, Bert, imagine having a disease that was 100% preventable, and they talk about heart disease. And some things aren't preventable, doctor, obviously cancers and things like that, but imagine a preventable disease, and that's what a lot of heart ailments are, right?
Absolutely, and really want to thank you for having me on. It's been great talking with you today.
My pleasure. As we wrap up, is there a website we could send people to?
Yeah, so for more information and safety information, you can go to vascepa.com. That's VASCEPA.com.
All right, Dr. Budoff, thanks for getting up early with us today. I know you're out in California, but thanks for the time this morning, all right?
A pleasure. Take care.